Welcome to Healthy Living. Today we're here to talk about the newly constructed St. Tammany Health System Surgery Center. The Surgery Center is a 126,000 square foot leading edge facility. It's the most leading edge facility of its kind in the Gulf South region. So we want to talk about that facility today. It's located on Bootlegger Road, 16282 Highway 1085, and it's right next to our Paul D. Cordes outpatient pavilion. So today I brought two of my colleagues with me who are experts in surgery and will be working as part of the surgery team at the new surgery center. And they were kind enough to take time out of their day as they prep for the opening to talk with me about this facility and how important it is to our community. So first, I want to welcome Amy Wade. She is a director of pre-op and post-op at the Surgery Center and Extended Recovery. So welcome, Amy. Thank you so much for coming today.
Thank you for having me, Amy.
Yeah, very happy to have you here. And I was doing a little background snooping, and you just celebrated your 27th anniversary with the St. Tammany Health System. So congratulations on that.
Thank you.
So the Surgery Center is slated to open in early March, and we are getting ready for that. At the time of this taping, we haven't quite opened yet. The facility is just about ready to go. Y'all are putting all the finishing bells and whistles on it. So tell us a little bit about your experience first with St. Tammany Health System and specifically in surgery, because one of the things that is really important to the operations of this facility is the tenure and the experience of the staff. So can you share with us a little bit about your experience?
Sure, Amy. Like you said, I've been at St. Tammany for a very long time. I began my career on the night shift on the orthopedic general surgery unit and stayed on that unit until taking my new position here at the new surgery center in some capacity. I've been a director of that unit for 21 years. Before I made the switch. So we cared for all orthopedic patients and also any kind of wide variety of general surgery patients. And in addition, and early on in my career, we took care of pediatric patients as well.
Okay, so that's all going to dovetail nicely into what's going to go on at the Surgery Center. So we should qualify by saying that the St. Tammany Health System Surgery Center is a 23-hour surgeries that can be performed in 23 hours or less. So it is an outpatient surgery center. That's what it's intended to be. It does have other features in case you need that extended stay, but we'll get into that a little more in a little bit. So in your role as the director of pre-op and post-op, let's talk about some things that you want people to know about the new surgery center as far as pre-op and post-op, the services that are necessary after you do have surgery. So what does your team do?
I want the community to know that we have some of the most experienced RNs on our team that have been at St. Tammany for a very long time in various roles, including critical care, the emergency department, and various adult health units throughout, even specialties in pediatrics and the NICU as well. So we're bringing a team together who's going to be able to provide safe and efficient care to all of our patients throughout the perioperative process. We want you to feel safe and at home and relaxed, knowing you will be in good hands throughout the process.
So when you come into the surgery center, when you come in to have surgery, if you walk through that pre-op area, everyone has their own little space. You're not sharing a room with anyone, and there are some features in there to help keep you safe. Like you said, we have the indigo blue lighting that is located within every restroom within the pre-op and throughout actually the facility, and that helps to keep everything sanitized and clean. So that is a good feature of the pre-op and the post-op area. So what does that look like? So when you talked about your experienced team, tell us about the people that they're going to meet when they're being taken care of before they go into surgery. So
well, when our patients arrive, they're going to be greeted by a patient experience specialist at the front desk who will guide them through registration and then eventually to the RN who's going to be assigned to take care of them in pre-op. That person will get you ready for surgery and guide you back to the OR where the operating room team will take over at that point.
Okay. All right. And like you said, they're some of the most experienced RNs on the North Shore. They're a cohesive team. They've been working together for a long time.
One thing I want to add too is pediatric surgeries are about 33% of our population. In the outpatient arena, we have pediatric specific RNs who do a fantastic job taking care of our children and supporting their parents and their caregivers. We've dedicated space to them, so they each have the pre-op area and the post-op area both have dedicated rooms, and we call them pods at the nurses station, specific for peds, so they don't have to be intermingled with adult patients, and they have those specific nurses who really focus on the pediatric patient. They're also going to make sure that the family members and the parents feel safe in our care and that their child is going to be well taken care of.
Yeah, and there's popsicles. Okay.
We have a fancy popsicle machine.
And you can definitely tell the difference when you move from adult to pediatric, the postoperative recovery area. It's obvious that, you know, the children are going to be in that part of the part of the center.
Kid friendly.
Yeah. So I touched a little bit on the safety features. So we talk about world-class healthcare close to home, and that's what we deliver. So what are some of the safety features that I didn't touch on that will be in place to ensure the best experience for the patient?
And you did touch on the Indigo lighting that's in all the patient bathrooms, and that's the cutting edge technology. I think we're the first in the state, we'd like to say, that have this technology. So even when you're not in the bathroom or in certain areas, the Indigo lighting is doing infection prevention behind the scenes. So that's really a cool thing for us to have. We also have a nurse call system where nurses wear locator badges, so we can answer your call from wherever we are in the nurses station. And if we can't answer the call, it will be answered by one of our team members, so that you can get your questions or concerns answered in a timely manner, or in case of an emergency. We also have cameras in every recovery room that give us an opportunity to have a second pair of eyes by an RN from the nurses station during your initial phase of recovery. So we think that that's going to be help us make you feel safer during that process. In addition, we have CRNAs, which are nurse anesthetists. They're in-house 24/7. So in the event that we need a little bit more attention for you, if something should go wrong during the night or any other time during the day, so we have those special nurses in-house.
Okay, well it's a well-rounded set of care, and it's a beautiful facility. Like you said, leading edge, state-of-the-art, and even the layout is very efficient, especially for the pediatric patients. I think that we should say that the surgery center was obviously designed by architects and experts, and it had guiding input from you guys, the clinical people who will use the facility and who know what's important, where it's important to instill those efficiencies, particularly in the pediatric space. So there are efficiencies there so that the patients, they go directly into the OR. They're not, wheeled through some area that is strange to them. So little things like that are part of what make this facility leading edge. So as a clinical person who probably had some input into this facility, that we should say that it's been in the making for 5 years now, which is we're excited to finally open it and get it going. What would you say is one of your favorite things about the facility?
I would like to say the open spaces, the windows, the calming colors, and the beautiful art truly makes me feel like I'm working in a 5-star hotel with the best medical team in the whole world.
Oh, that's really sweet. That's
really
wonderful.
Excited about us opening really soon.
Yeah. Is there anything else you want to add?
No, I'm just proud of our facility, and I'm proud to be an employee at St. Tammany Hospital.
Well, Amy, we certainly appreciate you being with us today to talk about it and sharing your knowledge and expertise. So we will be right back with another guest, Mr. Brian Grom, and he will talk to us about the surgery center from his role as Director of Anesthesiology. We'll be right back.
Just this morning, optimism and strength prevailed. Many hopes became reality at St. Tammany Health System. Dedicated to more little miracles. And the bigger ones, too. One of many reasons we're #1.
Welcome back to Healthy Living. So with me now is Brian Grissom. Brian is the Director of Anesthesia at the St. Tammany Health System Surgery Center, and he is going to continue our conversation about our new leading edge facility that is slated to open in early March. So welcome, Brian. Thanks for being with us.
Nice to be here. Thanks for having me.
Good. So it looks like I also did a little digging on you. It looks like you're going to be with the health system 17 years this April.
Yep.
So congratulations on that. Tell people a little bit about your background, what you've been doing with us for that time.
Well, for that period of time, I've been a staff nurse anesthetist here at St. Tammany. I've been in a lead or director role with the anesthesia department now for probably 6 or 7 years. So.
All right. So I have seen you in action at the surgery center, you and Amy both. I've been on a tour with you through the surgery center, and it is a fantastic, I mean, leading edge doesn't even begin to describe the facility. Yeah. So tell our guests, our watchers, an overview of the new facility and what they can expect if they need to come there for surgery. What can they expect?
Yeah, so I think, you touched on a little bit of it with Amy, but it is a 126,000 square foot facility. We're going to have 12 operating rooms in the facility. There are 24 private pre-op bays in the facility, all with private bathrooms. So the experience of coming to the facility and getting ready for surgery is certainly going to be second to none. There are 18 post-anesthesia care bays as well for your recovery, and those are also private, which not too many facilities have private recovery rooms, but we do there at that facility. We're going to treat a wide variety of patients there: pediatric and adult general surgery, ENT, orthopedics, urology, hand surgery, podiatry, and plastic surgery. Ortho, I don't know if I mentioned ortho, but we'll be treating a wide variety of patients there for sure.
So, go on.
Yeah, the patients we'll be treating will include patients that require 23-hour observation. We'll be doing outpatient surgery there as well as patients that require 23-hour observation. There's a 15-bed unit upstairs that patients will be, able to spend the night if their surgeon or if they decide that that's something that they need.
So somebody's going to be on staff 24 hours a day?
Yeah, 24 hours a day. We'll have nurses upstairs with the patients. Anytime a patient's in the facility, we will have anesthesia services in-house with those patients. Basically, those patients will be going upstairs as part of an extended recovery period. It's not to treat patients medically, but we'll be watching those patients for post-surgical complications as well as potentially some anesthesia side effects we'll be watching for as well.
So we talked a little bit with Amy about some of the features that are safety features, but what are some of the features that make us one of the most actually leading edge facility in the Gulf South? Because there's specific things that I remember you talking about, like the size of the operating room, for example. What are some of those features?
Well, certainly the size of the facility, the pre-op bays, the post-op bays, the size of the operating rooms, but primarily what makes us so cutting edge is the technology. I mean, we spared no expense with the technology that we put into the place. We have the most advanced anesthesia machines on the market today. We have the most advanced robotic systems on the market today, the Vinci robot system, the Mako robot system for orthopedics. Not many facilities have the advanced technology that we have there at the surgery center. So,
well, one of the areas that I was particularly fascinated by, which I can't go in anymore because it's off limits to civilians like me, but the sterile core and the sterile processing area, which is really important to surgery.
It is.
When it comes to the instrumentation. So can you talk a little bit about that?
Well, the sterile processing department there is certainly second to none. We bought all of the latest and greatest technology when it comes to that. You mentioned the indigo blue lighting. The sterile core also has the indigo blue lighting, as well as some of the most advanced cart washers and machines that process sterile equipment for the operating room.
So what is sterile processing? Can you just tell folks? Because I didn't really realize until I was looking at it. I mean, I knew what it was, but you don't really realize until you see it.
Right. So it's the area in which we take all of the instruments that have been used on previous surgical procedures and process them, getting them ready for the next procedure, as well as the area that we take in implants and things that will be used in surgery, and process those implants that are brought in from outside vendors. So.
Okay, so very important to everyone's safety, and it's second to none.
Yep.
So anesthesiology, why is it important to have an anesthesiologist on staff 24 hours a day? And Amy touched on it. And correct me if I'm wrong, we will have a pediatric anesthesiologist on staff as well?
So we do. We have our anesthesia group. We have a fellowship-trained pediatric anesthesiologist on staff at St. Tammany Hospital. Jackie Volpe. She keeps us all up to date on the latest and greatest when it comes to the care of pediatric patients. We also have a number of very experienced pediatric CRNAs that will be working with our pediatric population there at the center.
Okay, and that is important because children are not adults, basically.
Right.
They need different care.
A little bit different. They do need some different care, and there's some things we do to make the patient experience for pediatrics a positive one. And we pride ourselves in our pediatric care there at St. Tammany.
Yeah, so we talked with Amy and you a little bit about the cohesive team and the breadth of experience that will be available in the leadership roles, particularly at the surgery center. How important is that to me as a patient? Why does that even matter?
Well, I mean, you want a team that's very experienced. You want leaders there that have experience when taking care of a wide variety of patients. A team that is cohesive and works well together, and that's what we have there at St. Tammany.
Okay, so I asked Amy this, and I'm going to ask you also. Oh wait, I want to add one more thing. Let's talk about how close we are to St. Tammany Parish Hospital, our flagship.
Right.
You know, in case you need us to be.
Most surgery centers have an affiliation with a hospital. They have a contract with a hospital that they can that they can use and depend on to provide services should the patient need services outside of what's available to be provided at the surgery center itself. We're only about 5 minutes from St. Tammany Hospital. We have a lot of support staff from St. Tammany Hospital available all the time, 24/7, for patients that are going to be in this facility. So that's a very important thing when it comes to safety of our patients.
Great. So now I'll ask you the question I asked Amy. What, as a clinical person, is your favorite thing about this facility,
well,
if you could pick one?
The technology, one, is one of my favorite things. Like I said, we have the latest and greatest anesthesia machines, the latest and greatest ultrasound machines, the latest and greatest robots. But I kind of agree with Amy. The size of the place, you know, I've worked in a lot of different operating rooms through the years, and these operating rooms are second to none. I think they're 640 square feet apiece. The technology that's in those operating rooms, the artwork in the facility, the private rooms, those are some of my favorite things. So.
All right. Anything else you want to add before we wrap up?
Well, I just want to say that, you know, if you're a patient in this area and you're looking for a first-class experience, you know, here close to home, if you're in need of surgical services, I think St. Tammany Surgery Center is the place you're going to want to come. So.
All right. Well, thank you so much for joining us, Brian. So ask your surgeon if they practice at St. Tammany Health System Surgery Center so that you can be treated there if need be. And we do want to mention that our St. Tammany Health Foundation and their Healing Arts Initiative is responsible for the beautiful artwork that both Amy and Brian were discussing. And it is located throughout the building. It's beautiful. We also have dining services in there for folks that are waiting on their loved ones when their surgeries are finished. So we have lots of different features. Please stay tuned to our website and our social media pages for more information. And thank you for joining us for this edition of Healthy Living. We'll see you next time.